Hi, everyone. Thanks for being here. We're going to get started in just a minute. I'm just letting everybody filter into the chat. Good evening and welcome to Happier Cats and Happier Clients, Diagnosing and Treating Feline Osteoarthritis with Dr. Mike Petty. I'm Christy Keith, Senior Communications Strategist for Fear Free. Before I introduce our speaker, I'd like to take care of a couple of housekeeping items. First, we would like to thank our friends and fear-free sponsors at Zoetis for making this webinar possible. And we'd also like to thank all of you for making time for this webinar. We really appreciate you being here. We know how busy you all are. This presentation is being recorded and it will be at fearfreepets.com/webinars as soon as it's been processed, which will probably take around 2 weeks, unfortunately, but that's around the time right now. But fortunately, it's now my pleasure to introduce our presenter. Dr. Michael Petty is a level 3 fear-free certified veterinarian, a 1980 graduate of the veterinary school at Michigan State University, and I live in Michigan too, so yay. He is owner of Arbor Point Veterinary Hospital and the Animal Pain Center in Canton, Michigan, and has devoted his professional life to the care and well-being of animals, especially in the area of pain management. He is the past president of the International Veterinary Academy of Pain Management, a frequent speaker and consultant. He's published articles in veterinary journals and serves in an advisory capacity to several pharmaceutical companies on topics of pain management. He has been the investigator veterinarian in over 12 FDA pilot and pivotal studies for pain management products. He has lectured both nationally and internationally on pain management, and we are so thrilled to have him here with us tonight. I'm going to turn it over to you now, Dr. Petty.
Thanks, Christy, and I'm thrilled to be here as well. So just to let you know a little bit more about me, I think Christy covered most of it here, but I am certified in acupuncture, rehabilitation, and pain management through the IVAPM. And I do consult with several corporations in the veterinary field. I try not to ever let this influence my lectures, even when I have a sponsor that is paying for the lecture. I try to give impartial information. The other thing I really like to try to do when I lecture is to, I don't want to say dumb it down, but I try to do plain talk and just make sure that everyone that is listening to this can really take something away from it. There are a couple of science-dense slides on here, but I'm not going to go into minute detail. We'll kind of explain what they mean. It's late at night for some of you, and I don't want to lose anyone to sleep. So today's objectives, we are going to talk about fear, anxiety, and stress and how it relates to pain. We are going to be talking about diagnosing pain in cats, and most importantly, using a team approach to do that. I'm going to go over how I do a pain exam in cats, and we're going to talk about some of the metrology instruments that are available. And then the really exciting part is we now, as you probably know, have a treatment for chronic OA pain in cats. So away we go. I like to talk about fear, anxiety, and stress and pain as two sides of the exact same coin, heads and tails. You can't have one without the other. And I'm going to explain why I think this is so. The effect of behavior on pain. Chronic pain can become what we think of as normalized. You know, the cats, and we do the same thing as well. You know, when we have a chronic pain issue, we accept it as part of our daily reality and we get by. Unlike us who can complain about it and talk about it, cats don't really do that. They just try to go about their daily existence as normally as they can. That really makes it difficult for diagnosis on our part and recognition on the owner's part that there's something wrong. And, you know, here's the scoop. The source of the pain can worsen as time goes on, and this causes decreased exercise. We have decreased joint lubrication because they're not moving around, loss of supporting muscles, weight gain, all these things start to really build up. What else can it do? We're looking at aggression, fear, caution, anxiety. these agonistic behaviors serve to help avoid contact with humans and other animals because that might cause pain. And, I think a good example is if anyone has ever had a chronic or actually even an acute painful issue with like your wrist, your elbow, your shoulder, and you learn how to move that arm around. I've got some chronic rotator cuff issues, and I'm just careful. I know where to move my shoulder so that it doesn't hurt. But someone who can come up to you and shake your hand can really just about drop you to your knees, right? So you become very cautious about having someone shake your hand. Think of animals that don't really put it into that kind of aspect. The cat wants to avoid contact. It doesn't want to be pet. It doesn't want to be picked up or brushed because you don't know how to move your cat, or the owner doesn't know how to move their cat without causing some undue pain. We also see other things like house soiling. Why do we see house soiling? Well, maybe because it's really hard for cats to walk on regular cat litter if they're arthritic, or the sides of the box are too high, or what a lot of people do, they tuck away that litter box in the basement where they don't have to look at it or smell it. And the cats are like, can't be bothered. I'm just going to go here. The other thing too is sometimes we'll see different changes in resource guarding where, they don't want the other animals to get around the water bowl, the food bowl. We see this a little bit more in dogs than we do in cats. Another really big one is disturbing or waking the owner at night. And, I was always perplexed a long time ago when I would it sounds like it's hyperthyroid. It looks like it's hyperthyroid. The cat's crying at night. It won't sleep. And we run the thyroid test and it's normal. And I would scratch my head and go, what else? Well, since then, I've learned that oftentimes these cats are painful. And as you know, when you're awake during the day and you've got something painful, there's a lot of background noise, okay? And by background noise, there's other stimulation going on. There's sights, there's sounds, you're moving around and so forth. What happens when you lay down in bed? Then there is very little background noise and you feel that pain more acutely. So another huge reason. So I want to kind of pose the question of what if fear and anxiety stems from knowing what pain is? And I want to use a human example. And there's this Scottish woman, her name is Jo Cameron. And as it says here, she was born with the inability to feel pain, and which is amazing. I look at her, she's got all of her fingers and stuff. Amazing she didn't cut something off. But as it says here, she burns herself in the oven and her only clue is she smells singed flesh. She has had all sorts of issues happen. On the left, you can see broken arm. She's gone through childbirth. She face planted on some concrete, lost her front teeth. All this stuff has happened and none of it hurts. As a result, and I have a question mark because it's not absolutely positive, but she never feels anxiety. She has no idea what fear is in her life. So there we go. Fear, anxiety, and stress. It's very possible that because she has never felt that pain, that is part of the issue. And there was a recent study, I think it was published in 2020. I can't remember all the authors. I think the lead author was Dr. Mills, but and they were saying that up to 80% of behavioral problems have pain as their base. So it's something that we always have to consider when we see behavioral issues. So on to a team approach to diagnosing pain. And I'm going to kind of go through the team. And I have basically listed these in order of importance. And yes, the veterinarian is at the very bottom, okay? The owner is at the very top. And why is the owner at the top? Because without their cooperation, we cannot diagnose this pain. And more importantly, we can't treat it if we can't convince the owner that there's an issue. The next person is the receptionist, followed by the technician, the animal itself, and of course, myself or you if you're a veterinarian. So going back, we've got this, it's a complete puzzle, but without any one of these things, what does it all mean and how does it all get put together, right? So I'm going to start with the receptionist, and it all starts with a phone call. And, you know, the receptionist has the opportunity to really steer the entire future event. One of my favorite things, and this is a dog thing, but, you know, one of my favorite things was my receptionist said, I had a client, she wanted to make an appointment for a rabies shot, and I suggested 10:30 in the morning. And she said, well, I can't do it. The owner said, I can't do it till after 3 because that's when my husband gets home and the dog can't jump in the car anymore. You know, so the receptionist could have ignored that, but instead they made a note and put it down that there's something going on. And these are the kinds of things that they hear and on these four dialogue boxes. And, you know, they need to be able to put that into the appointment notes so that when they come in, the technician has an idea of where to go. Because if they have a little bit of idea of where to start with this whole thing, then the progress of the entire exam goes a little differently. They can ask some more pointed questions, and they can hand out things like pain metrology instruments. So, you know, the technician has now taken a look at the notes from the receptionist, and then she has given her a form to fill out. And or she wants to, and she's like, I'm going to give you this pain questionnaire. Oftentimes the owners are in a hurry, they got the cat there, they're like, is it going to take long? And this is kind of a warning that I've learned through experience. It's got to be simple, it's got to be quick, or at the very least has to be fun. And there are some fun things that they can do. So Zoetis has done a great job with some interactive questionnaires. So the next step is the owner. And we have to have the owner on board at this point to take the time to fill out the questionnaire and to really start thinking along those lines. And I will be honest with you, probably only half of my suspected osteoarthritis patients ever get the kind of attention that they should from the owner's perspective. You often have to say something. It has to sit in the back of their mind. You explain why you think it, and they have to go home and watch the cat and then call you back. And that's often how this happens. So here's the one I was talking about. And don't worry about what this is or where it is. There's going to be a QR code at the end where you can find these things. But, you know, that shows the black cat's normal, the orange cat has arthritis, and the owners can go through and play each of these, and they can actually click on them when they think, oh, this is my cat. And then it will add it all up for them and tell them, you know, we are suspicious that your cat has arthritis and that we need to look at your cat further. Okay. So now the veterinarian. So I kind of half-kiddingly said we're the least important, and we really are, only from the point of view that if we don't have the input from everyone else, our job is incredibly difficult. But ultimately, it is up to us to examine the cat and try to decide through history, through examination, and possibly through diagnostics, like radiographs, that the cat does have arthritis. So I'm going to talk about a typical cat case. And this one came to me, I think it was back in like December or January of last year. And this is what happened. So we're going to talk about what the receptionist heard. The receptionist heard that the cat's not using the litter box. And it's not just that. They say, I think my cat's pissed off at me. I think the cat's annoyed of this or that, or they hear other things like my cat's getting old and it just doesn't want to do what it used to do. All sorts of things. People make a lot of excuses, but they rarely say my cat's in pain. They do if it's acute pain, but not if it's a chronic issue. So, she gave the warning to the technician, not using litter box. At my clinic, this is, one of a couple of things that we always consider, not only things like cystitis, but we consider pain as the underlying cause. So Rambo's an 11-year-old neutered male, domestic short hair. Is not using a litter box. Has 2 cats and 3 boxes, so they knew that rule. But they said that, you know, the technician asked to describe the boxes, and he said, well, we keep them kind of high because they're always spraying litter all over the floor. However, they said that the cat's often seen scooting, and sometimes it vocalizes during defecation. So they were pretty convinced this might be a GI issue. And to make it even worse, they went through that exact graphic that I showed you before, with the cats doing different things, and they didn't check any of the boxes. They said, my cat does all this fine. And you will hear that and see that, because again, it's not the first time they see it. It's then when they get home and they have that in their memory that they start to watch the cat that they realize, yeah, something's going on. And remember, vocalizing during defecation, defecation might be painful because it's constipation or diarrhea or whatever. It might be painful because of the position that they have to assume, that squatting position, in order to do it. If they have some lumbosacral disease or something like that, that can be a very painful thing to do. We're going to talk about pain exam in cats. And one of the last couple of slides that we have in this talk, again, I'm going to have a QR code, and the QR code is going to have Duncan LaSalle's go through and do these videos for you. And these videos are going to, he does it in a really good way. And he does it with 2 different cats. He has a cat that's very cooperative, but he also has a cat that's less than cooperative. And he kind of talks about how to go through them. In the meantime, I'm going to go through and talk about doing an exam. Rambo had a fear anxiety score that really didn't make him, he was actually okay to examine. His big problem was he would try to escape. He would try to, get off the table, hide under the chair, and he would let me look at him, but I didn't want to put him through taking pictures of going through the exam. So instead I used my daughter's cat, Elvin. Elvin's a very cooperative cat. And I do have to say, after these pictures were taken, of course, you get all done, you put them on, and then you look at them, and it's like, oh, it looks like she's scruffing the cat. And she really isn't. She's holding the cat's head down. She, every time she would not hold the cat's head down, Elvin would pick his head up and try to look at what I'm doing, and it would obscure the picture. Scruffing is a fireable offense in our practice, and we do not scruff cats. So, elbows. So whenever you palpate anything, you have to put your thumb on the joint and move it as you move it around. You're feeling for crepitus, you're feeling for swelling, any kind of edema around the joint. And as you look at an elbow, if you're going to flex it, you've got to have the carpus bent as well, as you can see, as I have in this picture. Different when you're extending it, the carpus straightens out naturally. You just don't fight the other joints as you're going through these ranges of motion. And again, you don't have to do these necessarily in this order. And if you've got a cat that you've watched walk around and you're suspicious of a certain area, then don't be afraid to just start there and see. But I actually like to start at the joints that I feel are not painful, just so that if there's any surprises, I can find them, and I don't spoil the exam, so to speak, by starting with the most painful joint. So next we're going to do a shoulder. And when you flex the shoulder back, you can see how I'm doing it. I'm trying to not put any pressure on the elbow. So I'm kind of trying to grip the entire leg. And then I've got my thumb on the shoulder joint. But when you move the shoulder forward, you actually have to block the shoulder blade itself. The scapula will slide forward without actually even, when you try to extend the shoulder, and you're not getting any movement within that shoulder joint. For reasons of clarity, I have my right hand blocking the scapula. In reality, I would also have the thumb on my right hand right on that shoulder joint to feel for crepitus. And there's just another picture as I go forward in the motion. The lumbosacral joint is often overlooked in a lot of animals. And the reason it's often overlooked, we just don't really think about it. We'd like to think about knees and hips and so on. But if you go looking for it, it's often there and there's an issue. So what I've done is oops, I'm going too far. So I've got my, my hand up under the pelvis and I'm holding him kind of like at the top of the lumbar spine when I actually do this. And then you pick up the legs like this. And I've got my left thumb on the lumbosacral joint. And I can feel if there is any pain or resistance as I go through that motion. And then finally, the hips. Again, the same issue. Knees and hocks, you can actually do those two at the same time. And there we go, flexion and extension. Okay, so let's go back to the original cat that we're talking about. And we are going to, and I'm going to put down what I found in the physical exam. So behavior, we called it was a 3, maybe a 4. He had this escape behavior, wanted to hide under the chair, but not really aggressive in any way. The GI tract had minimal soft stool and a relaxed abdomen. There's no apparent pain response during the palpation of it. And the musculoskeletal exam showed a guarded painful response when the lumbosacral joint was palpated. Mild crepitus in the knees. Because he had been scooting, we checked the anal sacs. They were normal and empty. So I did discuss my findings with the owner, and I told them that I thought the cat was using the litter box because of osteoarthritis, and we discussed radiographs. But at that point, he was pretty insistent that it was a GI issue. And he said, you know, from time to time, I think maybe the hips hurt. So he was already starting to come around to what we were seeing in the exam and discussion. We made a treatment plan. And I said, let's treat this as a behavioral issue. But I asked him to keep in mind there might be an underlying cause and that it could be osteoarthritis or it could be GI disease. So we decided to have him use Dr. Elsie's cat attract litter, which cats feel really compelled to pee and poop on. I also asked him to get a slightly lower litter box the cat could get in and out of. And then I said, let's get the cat back in for either radiographs or GI panel or both, depending on how this goes. So a few days later, my receptionist got a phone call. And after the visit, the owner went home, thought about it, and thought, you know what, maybe this is a pain issue. So she asked him to take some videos of the cat doing things, walking, jumping, using stairs, and made an appointment for radiographs and some initial lab work. So here's the first video. And this is Rambo using the stairs. And as you watch, it's a little hard to see there's something going on. I can see it immediately because Rambo is not going down those stairs very gracefully. So don't be afraid to take these videos that the owner sent you. And the owners are usually very happy to send you cat videos. I mean, they're taking them all day long anyways, right? And we're going to watch him go down in slow motion. And I want you to see how, and I can't recall right at the moment, but he always leads with the same back leg going down the steps. He should be using one after the other, but he's always leading with the same one. And I think it's the right hind that bothers him the most. Nope, it's the left hind. So he always puts the weight on and I'm going to rerun that here for you. He always puts the weight on his right hind as he goes down because it hurts on his left hind leg to jump down and put that pressure on there. And you can see how it becomes even more apparent with the slow motion that it's pretty jerky. Then they sent another video of Rambo jumping up onto his favorite spot. But look at the hesitation on this poor cat. He's like, I want to go up there. I really want to go up. He gets to the first step. He can't just jump up on it anymore. He has to use a stepping stone. And look at that tail whip around. The anxiety of wanting to get up there is just overpowering for him. He's even thinking, is it worth it? But I really want to go up there. And he has to really think about it. And there he finally does it. His favorite spot in the house. But that was like, what, 30 seconds of decision? Cats don't usually do that. Let's look at the radiographs. So this is my theory that cats are really aliens because their radiographs of arthritis really don't look like radiographs in dogs that have arthritis. Because, so on the left hind leg, you can see there's a small area down there of osteoarthritis that's typical of what you might see in a dog. But then you've got these little osteophytes, these areas of calcification that are distal from the affected joint. And I will see these in tendons, I'll see them in ligaments, I'll see them embedded in the muscle. And this is all real. This is all part of that joint osteoarthritis. Probably take a better mind than I to explain exactly why that happens. Remember when I talked about the lumbosacral joint being a big issue in a lot of these cats? There you go. The circle on your left shows that it's spondylosing. You can actually see that there is some sclerosing of the L7, S1 end plates. This is from the chronic irritation that's going on there. And then on the acetabulum, you can see that it's somewhat sclerosed as well on this view. Here is the radiograph, the VD. And look at that left hip. It's starting to get that mushroom cap look to it. And if you think back to the video, this was the hip that was, or the leg that the cat didn't want to lead with as it was going downstairs. So arthritis in both knees, arthritis in that left hip. It's no wonder the cat's having an issue. Before I start an older cat on any kind of regimen of treatment, whether it's pain or anything else, it's a good idea to run some lab work. And the reason being is, if something does go wrong, it's usually the medication's fault, right? So if we know that, for example, there was an elevated creatinine or ALT or something like that prior to the treatment, then if it's found later, then we say, well, it's really the same as it was before we started the medication. But I promise you, and you've all experienced this, it's always the fault of the medication once, the problem's discovered. Okay, so that's how I go through and diagnose and osteoarthritis. And now we're going to talk a little bit more of the, what do you want to call it, the more technical part of it. So it is the most common musculoskeletal disease in cats. 40% of all cats have clinical signs, but that doesn't mean that everyone recognizes it. Just people don't know how to look for it, or again, they're blowing it off as an age problem or something else. So I think maybe in my practice, 5% of my clients actually recognize clinical signs, maybe even less. And I would guess that for the untrained veterinarian, probably about the same percentage. There was a study done at North Carolina State University. It was retrospective. They went back and pulled out radiographs, and they found that 90% of cats older than 12 showed evidence of osteoarthritis. Actually, that might not have been the North Carolina State one. But it's not exclusive to older cats. The North Carolina one showed that cats as young as 2 years old can suffer from osteoarthritis. However, it is strongly associated with age. Even though a young cat can have an issue with osteoarthritis, as they age, as time goes on, the evidence for osteoarthritis becomes stronger and stronger. And this can really affect different aspects of their life in big ways. You can see the circle to the left with a bunch of things suggested that it can cause. One of the things that we really want to be on the lookout for is decreased interaction with the owner and other animals. They may seem less friendly and more irritable. Isolation, remember I went back to that example. I want to go back to that example where, being around another animal or a person that might pick you up or something is frightening because they might hurt you. Well, when we go into isolation, they'll become less socialized, I should say, just to avoid that possibility. They lose interest in things they used to have fun doing. And, they no longer like to be picked up, groomed, pet, etc. So we have to have a need for new treatment options for feline OA pain, because we've tried a lot of other things and they have limited effectiveness. In my practice, we used acupuncture, rehab, laser. We also would talk to clients about using off-label NSAIDs. But, these are either sometimes they work, sometimes they don't. We have to be concerned about side effects and difficulty with pills. Cats, they don't want a pill, right? And the owners don't want to give it to them. They don't want to give them a liquid. They don't want to do any of that stuff. And so there is a real problem with cooperation with any kind of medication that you're going to give orally. And then going back to what we talked about, if you can't let them believe that their cat's in pain and that it really needs treatment, then the cat's not going to get it. They're not going to plunk down time, money, resources, etc., to treat something that they don't really believe in. So we have to think of analgesia as being foundational to a multimodal OA treatment approach. We have to control the pain. And we can control the pain by doing a lot of things, weight loss, support joint health, exercise, things along that line. We have to maintain mobility. As I said before, if they're not moving around, then their joints aren't getting lubricated. And all of these things can help slow the progression of the osteoarthritis. When we think of dogs, of course, we know that NSAIDs are the gold standard for treatment of osteoarthritis, actually in almost every species. But there are no NSAIDs in the US approved for long-term chronic use and for chronic pain in cats. And veterinarians are cautious with good reason about their use of NSAIDs in cats due to concerns about potential adverse reactions and potential legal ramifications if something goes wrong. One NSAID is black boxed. The other ones just none of them are approved for long-term use. As we look, now we're getting to one of the more dense slides, and we don't have to pay a whole lot of attention to it. But there's a couple takeaways I want to say. And the first column shows that there's a bunch of immune cells that often play a key role in pain signaling. As you look at this table from left to right, it goes from immune cells to the mediators and cytokines and the receptors. And these are all things that cause pain, but not all of them are really big key players. As you look for the second one from the macrophages lead to the second one from the bottom, the prostaglandin, which stimulates the EP4 receptors, which then cause pain sensitization. As you look down, the fourth one from the top, mast cells cause release of NGF, or nerve growth factor, which then stimulates the TrkA receptors, which lead to pain sensitization. So we can use all of these things to help control pain, but we have to pick the major ones if we're going to have a big effect on it. So what is a nerve growth factor? Well, nerve growth factor, it's belongs to a family of neurotrophins. And I don't like the order of these bullet points. The third one down, I think, is the next one we should talk about. It's important in fetal in newborn animals for the development of the nervous system. So they're very critical in young animals. But the second point down says it's a neuromediator that plays a critical part in the pain pathway. And that's because as we age, the primary role of nerve growth factor becomes less about growing nerves and more about being pro-nociceptive, and it enhances signals which then are interpreted as painful. So why do we want to target NGF? It's one of the major players that was discovered as causing pain. When you measure NGF in chronic disease joints, it has very high levels. So our goal is to try to reduce the excessive NGF to a more normal level and see if that reduces the pain. In response to injury or osteoarthritis, NGF is upregulated in the joint and contributes to joint pain. It binds to the TrkA sites, and TrkA is found on peripheral nerve endings and immune cells. Very, very present in the joints. So we have this new drug out, Silencia, and Silencia is changing the way we control pain in cats. It is the first and only antibody therapy for cats with osteoarthritis pain. The medication type, it's a monoclonal antibody. You probably have used other monoclonal antibodies like Cytopoint for itching. The active ingredient is frunevetmab, and the indication is for pain associated with osteoarthritis. It's easy to give. It's given by sub-Q injection, and it doesn't have to be given that often, only once monthly. Silencia works by binding to the free nerve growth factor. By binding to that, it lowers the amount of nerve growth factor available to bind to the TrkA. So, if you have less nerve growth factor, there's less TrkA stimulation. And remember, TrkA is one of the sensitization things in the joint. It also decreases the amount of substance P and calcitonin-related G-peptide released by the nerve endings. And this actually helps lower neurogenic inflammation. It reduces the amount of NGF available to bind other cells and tissues in the arthritic joint. And as I said before, the goal is to return the amount of NGF in the joint to a more normal level. So let's compare this with prostaglandin. So how does it work versus prostaglandin? Prostaglandin, or PGE2, sensitizes nerves to other molecules. So if we can inhibit PGE2, it results in effective pain control, dampens down the sensitization of nerves, and it reduces the ability to activate those nerves. NGF does the same thing, but it actually does more. It can help alter the phenotype of nerves, alters the expression of pain receptors, increase the number of neurotransmitters, and increases neuronal sprouting. So all of these things, actually, the NGF actually has a much, much larger effect on pain than PGE2. Pain is the primary experience and treatable sign of osteoarthritis. So when we look at things like prostaglandins, we have a mixed state of acute and chronic pain at the start of joint damage. Pain becomes its own disease state when it's left untreated. And to kind of recap, remember, it impacts cats' physical and emotional well-being. We now know there's a new understanding that nerve growth factor plays a pivotal role and is a key driver in OA pain. And it provides early effective treatment designed for long-term OA pain management. So what if we can target it to control the pain? This is where Silencia comes in. Now, I've had the privilege to both be one of the initial clinical studies, to run a clinical study for Silencia before it was called Silencia. And I'm also have the privilege of having had it in my clinic now for a couple of months as an early user. And I want to talk about this case, Tucker, and Tucker is a real patient of mine. And in August, he came to me because we had talked about Silencia prior. And, you know, as I mentioned here, we discussed using off-label NSAIDs for Tucker, but the owner was cautious, and for good reasons. And after we had a discussion of the risks, the owner declined. But I did promise her she'd be one of the first people I'd contact when Silencia became available. And when I got my first shipment of Silencia in, she was at my door the next day for that first injection. So I want to talk a little bit about the effect of this. And so this is the day before the injection and 7 days after the injection. The cats all vary in terms of their response to the injection. And so, you know, this testimonial that I'm giving, it represents an individual patient, and not everyone's going to have the same kind of response. But so far, on most of the cats I've used, we are getting this kind of response, and people are seeing something in that first week or two of injection. So this is a Tucker walking across the floor before. Oops, nope, that's the after stop. I don't know why that happened. This is Tucker walking across the floor. I mean, it hurts to even watch him. And this is Tucker walking across the floor 7 days later. Not perfect, is it? Sorry, that kind of jumped ahead. I'm going to go through it. You can still, he's still got a stilted gait, but nothing like this. Okay, so we asked them to do a video of Tucker going up the stairs, and this is Tucker before. This is like really difficult to watch. This is Tucker 7 days after. Yikes, it's amazing. You know what? Let's have a race. I'll give Tucker after a head start. Or the other way around, yeah. I should have given Tucker before the head start. Okay, there we go. Okay. Needless to say, this is one of many happy clients I have. They are just tearful and grateful that they have gotten their old cat back. I do want to read through this important safety information because it is for use in cats only. Remember, it's a monoclonal antibody. It's felinized. It is not for any other species. It could be dangerous to use in other species. Women who are pregnant, trying to conceive, or breastfeeding should take extreme care to avoid self-injection. Remember, this inhibits nerve growth factor. You don't want to inhibit nerve growth factor in a developing newborn. There could be hypersensitivity reactions, including anaphylaxis, which could potentially occur with self-injection. Silencia should not be used in breeding cats or in pregnant or lactating queens for what I just mentioned before, because it's anti-nerve growth factor. It should not be administered to cats with known hypersensitivity to frunevetmab. And the most common adverse events reported in a clinical study were vomiting and injection site pain. I don't have an exact number, but remember, this has been out in the EU and there have been a lot of injections given. So one of the things when clients talk to you about, well, this is a brand new drug, I want to wait and see, say, well, really is brand new to the States, but not so much to the world. I think another thing that we maybe need to wait and see on is if you ever have a cat come in that's had some kind of spinal injury, maybe we want those we don't want to dampen down the nerve growth factor. So that remains to be seen. This is my caution, not Zoetis's, but it's something that we should really think about. These are some external resources I promised you before, and I'm going to leave this page up for a couple of minutes so that you can take pictures of the QR code so that you can get these websites on. And these are really for the veterinary team to use. So on the far left is Dr. LaSalle's, and this is where you can find those feline exam videos. In the middle is a cat OA checklist. This is some of these things you can share with your clients. And then on the far right is a professional only website that really talks about Silencia. You can sign up to be alerted as soon as it's available, and so on. Get everybody just another second to make sure they got that. And then here we go. Here's a website for your clients. So you want to copy this one. It's called catredflags.com. And, this is like really important, and ask them to look at this. And I think one of the big stresses that you should make for them is that if they can do those videos in their home environment, we want to do this. Remember, this is for a fear-free evaluation, right? And there's always going to be some fear and stress in the clinic, and it might hide some of that pain. So you want to have them do those videos at home where none of that exists. So not only do you get a better representation, you're putting the cat through a lot less when it is in your exam room and you're trying to evaluate it. One of the things, so this is the official end of the slideshow, the Zoetis sponsored slides. I just want to share with you a couple of things I did for my clinic. And one of them is it's kind of grayed out in the background, but I asked my web people to put a banner that would pop up, and it says, "Is your cat hiding arthritis?" Because this is new, it's important. We need to get the word out there. And then when they click on learn more, there's a cat and a dog. We have just a general page, but on the cat slide, it tells them how to go to www.catredflags.com and look at those assessment tools. So this is the official end. Thank you everyone for attending. I really appreciate it. This is my oldest daughter's silly cat. He is, if you look in the background, this is a painting of the cat that my youngest daughter, who is an art major, did of him because he thinks he's this huge, tough tiger, and he really isn't. So, thanks so much for attending.
Oh, thank you so much, Dr. Petty. Sorry, that's all we have time for, everyone. We want to thank you, Dr. Petty, for being with us. We want to thank all of you for joining us tonight. And of course, to Zoetis for making this presentation possible. We hope to see you for our next Fear-Free webinar. You can view the schedule at fearfreepets.com/webinars, which is also where all our webinar recordings live. So you can see any that you've missed, including this one, which will probably be available in about 2 weeks. Thanks, everyone, and good night.
Good night.